Presenting this speaker does not imply endorsement by Friends Health Connection. The speaker's comments and opinions are her own. Friends Health Connection does not control the content of the webinars and is not responsible for the content presented. This event is not intended to constitute or replace medical advice, and appropriate medical advice should always be sought by your own medical professional. Pamela Miles is a Reiki master and integrative health care consultant in New York City who has pioneered the integration of Reiki treatment into conventional medicine and remains the foremost authority in the field. Pamela has practiced Reiki since 1986 and is the author of Reiki, a comprehensive guide, and numerous peer-reviewed medical papers. Pamela has created Reiki programs in hospitals, collaborated on medical research, and presented Reiki in medical schools, including Harvard and Yale. She is internationally recognized for her ability to express Reiki with clarity and elegance. Friends Health Connection would like to personally thank Pamela for hosting our webinar today. And without further ado, I now present Pamela Miles.
Thank you, Stephanie. And thank you, Friends Health Connection, for inviting me to be here and offer this short presentation on Reiki to help people understand that there is help out there for them. The title of the presentation is Reiki, what it is not, and how it can help you. And that's where I'd like to start, by talking about how Reiki can help you. And if you like, those of you who are on your computer, you can type in particular situations that you're hoping that Reiki can help you with, so that I will do my best to include them in the presentation.
Excuse me, Pamela, would you mind if I interrupt you for just 1 second? Can you just mute your
computer? Not at all,
computer?
but my computer is muted.
Oh, it is? Okay.
Yeah.
Go ahead.
Yeah, I heard the echo too, and I don't know where it's coming from.
Yeah, I don't hear it anymore. I heard it before, but now I think you're okay.
Okay, great. So welcome again. We're still here with Reiki, what it is not, and how it can help you. I'm wondering how many people who are with us today have ever experienced any anxiety. You know, anxiety is one of those things that everybody feels at some time in life, and although there are certainly medical ways to address it, and there are times when we're very happy to have that, there are lots of times when we just feel a little anxious, or we're anxious about an event or something that's happening in our lives, and we'd like a little help with it, but we don't want to take medication. Reiki can help with that. You know that pain afflicts over 116 million Americans. You know, that's more than the combined number of people with heart disease, with cancer, and with diabetes. And it's not surprising that so many people suffer with pain, because many, many diseases bring pain in one form or another. But besides those recognizable types of pain, there are also many kinds of pain that can't be quantified and can't be addressed medically, and are not responsive to pharmaceuticals. And again, if you have pain, or somebody that you know and love has pain, this is something that Reiki can help with. Stephanie, I am hearing an echo.
Yeah, I'm hearing that as well. Pamela, would you mind? I'm going to try to hit star 5 again, if you wouldn't mind hitting the star 6 that I told you about before. If you just want to try that one more time, I apologize.
Sure. Okay, so we'll give it another
let's try that.
Right. Reiki can also be very helpful when people are preparing for surgery, not only because they have anxiety, but as a way of helping their systems become as balanced as possible. The more balanced we are, the more resilience we have in our system. And so then when something like a needed operation happens, our bodies are better able to withstand that stress. Even life-saving surgery involves quite a bit of trauma in the body. And surgeons are very, very aware of this. They understand when their work is finished and when the body has to take over. So we want to have our systems be ready for surgery, and Reiki is something that can help before, but then also when we're recovering from surgery or from an injury, from an illness, or even childbirth, which is perfectly natural but still quite a bit of trauma for the body. Again, this is a situation in which Reiki can help. In fact, there really isn't a situation in which Reiki can't be helpful, because Reiki practice is balancing. So Reiki doesn't address a symptom or a disease specifically in the way that a pharmaceutical or a conventional medical intervention such as chemotherapy would do, but rather Reiki practice addresses the whole person. It helps you become more balanced on every level, physically, mentally, emotionally, and even spiritually. Physically, what we see is that people feel better, they function better, they're sleeping better, they're digesting better. One thing that Reiki practitioners usually notice very early on in a Reiki treatment is that the person who's receiving the treatment relaxes and starts breathing in a way that is much more easeful. And that doesn't necessarily mean that the person starts breathing more deeply, because that's not always what's appropriate, but just that you can see that the tension has gone out of the breath. Often during a Reiki treatment, we can hear the person's stomach gurgle. We start hearing those sounds there. The medical term is borborygmi, and we all know what it sounds like when our stomachs are rumbling. But did you know that this is actually a good sign? Because it shows that the digestive system is beginning to engage. And one of the most important things that our bodies do that helps us to maintain our health or to regain it when we've been ill is to digest the food that we eat. It doesn't matter how good quality the food that we're eating is. If we're not digesting it, it just becomes toxic. So improving digestion is very, very important. Another thing that we hear from people who are using Reiki, either receiving Reiki treatment from someone else or learning to practice Reiki self-treatment, is that they start sleeping better. Sometimes this happens right away. I'll often get an email from a client the very next morning, or I will hear from students who are learning to practice Reiki when they come to the second session of the class, how well they slept. Occasionally it takes a little bit longer to show up, but in my experience, and I don't know of any medical research on this, but just in my clinical experience over the 25 years that I've been practicing Reiki, within a week or so, everybody is sleeping better, even if they're not sleeping as well as they might be after they've been receiving Reiki for a little bit longer. So what is this Reiki that I'm talking about? It is a spiritual healing practice that is balancing. balancing to your whole system. Reiki practice is generally facilitated by light touch. As you can see, placing my hand on my upper chest, one hand on the crown of the head, and also if for any reason you don't want to be touched or can't be touched, if there's an injury or something, then you can float the hand just off the body. You can receive Reiki treatment from somebody who has taken even the very first level training. It's called first degree, or sometimes people refer to it as level 1. And so, for example, I first experienced Reiki treatment from a friend of mine who had taken the class just the week before, so she was hardly an expert. But she knew that I was in the early weeks of a pregnancy and feeling very healthy, but, feeling a little nauseous, a little tired, the way women often feel when they're having a healthy pregnancy. And so she offered to give me a Reiki treatment and told me that she wasn't an expert at all. But I knew her and I trusted her, and so I laid down on my bed sideways so she could reach the crown of my head, and from within just a few minutes after she placed her hands lightly on the crown of my head, I started feeling myself drop very naturally into a deep meditative state. And I knew exactly what this felt like because by that time I had already been practicing meditation and yoga for close to 25 years. And so I knew that, sometimes when you don't feel well, even an experienced meditator is not able to meditate as readily as you normally are able to. So I was very, very appreciative of this, and I could feel my body relax. I could feel my mind let go in a good kind of way, and just get very calm. And although she gave me a long treatment, it just seemed like 15 minutes, and it was over. And I didn't know a lot about what had happened, but one thing I did know, and that was that I had to learn how to do this to myself. So I called her Reiki Master, and I learned how to practice the very next week, and I've been practicing Reiki self-treatment every single day since then. Reiki is effective on someone whether you learn to practice, and most people don't need to do any more training than that very first training I did. I mean, I'm now a Reiki Master, but first degree Reiki practice is enough for most people. Then you can practice on yourself. What I do is when I'm lying in bed, either when I'm going to sleep or in the morning, I just start placing my hands comfortably on a series of placements, 4 on my face and head and 4 down the front of my torso, and just let my hands rest there and enjoy myself being in a very relaxed state for at least 20 minutes. But you can also share, once you train to the first degree level, you can also share Reiki with your friends and family in the same way my friend shared a Reiki treatment with me. Now, of course, this is great news for anyone who has someone who's ill in the family or for parents. When my kids were little, because as I told you, I was pregnant at the time and I had a 5-year-old already, I felt like my Reiki training gave me a first aid kit in my hands. And it's not that Reiki practice was all that we ever needed. My kids were both very physical. They were both involved in sports, and believe me, we had more than our fair share of x-rays because they were so physically active. But on the way to the hospital, I could have my Reiki hands on them, and they felt calmer. And the doctors invariably said something like, wow, I can see there's quite a sprain here, but I don't understand why it's not more swollen. And this is good news because when somebody has an injury, part of the rehab is for the injury itself, but a big part of the rehab is for the to resolve the inflammation, the swelling. This is one of the things that the body does in reaction to any kind of irritation or infection. It swells up, and this is what the body's doing, is marshaling its ability to repair and to fight off any pathogens that might be invading. But then, when things are better, you still have a lot of inflammation that needs to be addressed. And in fact, chronic inflammation is seen as one of the underlying health conditions that has been connected to a wide range of disease and is suspected to be connected to even more. Things like cancer and heart disease and even depression, that there is this global, throughout the body, state of inflammation that is lingering from onslaughts that the body has experienced that have never been resolved completely. And this shows an important way in which Reiki practice can really support your medical care, because conventional medicine is really great at the big stuff, like you get surgery and you get the heart valve replacement, for example, that you need, and you go through your rehab. But people are often surprised how long they feel tired after any surgery. Not everybody, but a lot of people. And of course, in our lifestyle, we're not always able to take as much time off work or away from taking care of our families as we might need to in order to have that deep, deep healing that would resolve something like a chronic state of inflammation. So, although there isn't any research yet into this, many people that I've worked in conventional medicine, bringing Reiki treatment into conventional medicine for almost 20 years now, and I train a lot of doctors. I have presented Reiki at Harvard Medical School, and I have trained medical students at Yale and many other medical schools in the U.S. And so I'm fortunate enough to get to speak to doctors a lot about these health conditions and how we can improve people's health. And there is a lot of interest in how Reiki practice, either to oneself or received in treatment from a family member or a professional, might be able to help with the deeper layers of healing, such as resolving chronic inflammation. Unfortunately, I don't have any research to cite on this, because who's going to pay for Reiki research? Not a lot of people. Now, the government has done some, but the medical research into Reiki is really just beginning. And one of the things that's happening is that we're learning how to research Reiki. And I say we because I have been involved in research. I have worked on research studies funded by the NIH, for example, and I'm a very strong proponent of having more research to document the benefits of Reiki. But at the same time, it's important that we are realistic about how much research we have. Of the beginning research data that we have, what we are seeing is that Reiki can be effective for helping people manage pain and manage anxiety. And although there hasn't been a really large study that has shown this, there have been quite a number of smaller studies looking at people suffering pain and anxiety in a wide range of situations. And we're seeing that it doesn't seem to matter what causes the pain and anxiety, people can find benefit from it. So, why is it that Reiki can be helpful in so many different situations? It's because Reiki practice is balancing. It's balancing to the overall system. And so on a physical level, you feel that you're breathing more easily, you're sleeping better, maybe you have more energy. On a mental level, people often say that they feel clearer, they feel effortlessly focused, they're able to listen better, and that their recall is better. They can choose words more easily. Now, again, I'm sharing with you what I have heard from my clients and students over 25 years of practice. Other than pain and anxiety, we don't have these other benefits documented, but I'd be willing to bet if you speak to 5 people who have practiced Reiki or received Reiki treatment, they're going to start nodding their heads and saying, yes, I feel that too. Emotionally, what I see is that people kind of get over it faster. You know how sometimes we have something that's lingering, whether it's a bereavement or anger from feeling slighted. And of course, grief is something that it does take time to get over, and we don't want to rush anybody past their own process of grieving the loss of a loved one or a pet. But still, even people who are grieving themselves sometimes feel like they could use some help. They feel really overwhelmed, and maybe it's been a while, but they feel that they're not able to move on by themselves, and yet they don't want to start taking medication if they can find something less complicated that could help them. And in this kind of situation, learning to practice Reiki self-treatment can. And then spiritually, I want to talk about spirituality for a minute, because sometimes people confuse spirituality and religion. And they're two really very different situations. Religion involves a dogma. People who share the same religion share the same beliefs. They share the same worldview to a certain extent. And for many people, that is an avenue through which they make a valuable spiritual connection within themselves. And that's wonderful. However, there are many people who have not found a religious belief that really resonates for them, or they don't know if they believe in God. And they can still either receive Reiki treatment or learn to practice Reiki treatment, because there is no dogma attached to Reiki. You don't have to believe in anything. You just have to be open-minded enough to have an experience. And what might that experience be like? Well, if you're going to receive Reiki treatment from somebody else, then what the Reiki practitioner would do would be to have you lie down fully clothed. Isn't that a relief? Fully clothed on a treatment table, or if you're not able to lie down, you might be sitting in a comfortable chair, maybe semi-reclining, however is comfortable for you with the health situation that you have. And then the Reiki practitioner will start placing hands on each of around 12 placements. There's a lot of variation between Reiki practitioners, but around 12 different placements on your head. I'll show you the ones that I use for self-treatment. I start at the crown of my head, either like this or like this, my face, my throat, and then place my hands at the back of my head, and that's very easy to do when I'm lying on my back, and maybe put some pillows under my elbows so I'm comfortable. And then I would place my hands on my chest, at the solar plexus, at the navel, and at the lower abdomen. When I'm offering treatment to someone else, if they're able to turn over, then I also place my hands on 4 placements starting at the upper back, the shoulders, and then behind the heart, then just above the waist and on the lower back, right in the sacral area. You know that place when your lower back hurts? There's one place where it really hurts. Well, that's exactly where we put our Reiki hands, and people always like that a lot. It's very, very deeply relaxing. So if you go for a Reiki treatment, I encourage you to make sure that your Reiki practitioner turns you over occasionally, because people are relaxing so deeply. The Reiki practitioner doesn't want to disturb them by turning them over. But what I've found is that, yes, I have to often wake my client up. Sometimes they're so relaxed they're actually snoring, even the first time they come for treatment. Even in the Reiki clinic that I run, where there are 6 people receiving treatment in a room full of strangers at the same time, we'll still hear snoring. And it's music to our ears to hear people being so relaxed. So I always ask people to turn over if they're able to, and place my hands on their back. And the feedback that I've gotten is that people don't mind being disturbed because they really appreciate what that feels like. As I mentioned before, there is quite a lot of variation in among Reiki practitioners, because one thing that Reiki is not is regulated. There are absolutely no standards for Reiki training or Reiki practice. And even though people will say, I'm a certified Reiki practitioner, honestly, the certificates are meaningless, because since nobody agrees what it takes to receive Reiki training, who cares if somebody has a certificate or not? So I always encourage people to ask questions. Don't just go at face value. Ask your potential practitioner or Reiki teacher questions like, how long have you been practicing? What is your practice like? Who do you practice on? Have you just been practicing on yourself, which is not a problem? My first Reiki treatment came from someone who had only practiced on herself, other than in her class situation. But you want to know this because, for example, if somebody is charging you and putting herself across as a Reiki professional, then she should have some reason for doing that, right? And you want to know, does she have a dedicated Reiki space? When you come for your Reiki treatment, are you going to be alone and have privacy? How long will it be? What will the fee be? You want to know that up front. And how does the Reiki practitioner take payment? That's another important thing. Don't assume that you'll be able to pay by credit card, for example, because many Reiki practitioners don't have the ability to accept credit cards. Also, you can ask the person what level. Traditionally there are 3 levels. First degree is where we learn how to practice hands-on, and that's enough to be able to share treatment informally with someone else. In second degree, Reiki practitioners learn a mental technique that enables them to do distant healing in situations where they're not able to touch, but still to use hands-on whenever possible. And then traditionally, the third level of Reiki training was called a Reiki Master, and this was for people who were dedicated to learning to teach other people how to practice Reiki. So if you want to receive a Reiki treatment, you do not need a Reiki Master. You just need a Reiki practitioner who is trained to the first or second degree level, hopefully that training, each training was about 10 or 12 hours in an in-person group class. So they were in the room with the Reiki master and other Reiki students, and then they practiced for quite a while before possibly learning the second degree. I ask my students to practice daily Reiki self-treatment hands-on for a very minimum of 3 months before learning second degree. I'd really rather have people practice daily Reiki self-treatment every day for the rest of their lives than teach them second degree if it's more than what they really need for their lifestyle. So in the Reiki marketplace, you'll often see that there's kind of a rush to being a Reiki master, and I caution you to beware of that because it's not necessary. And it's better for you to get very thorough training in the first degree and practice every single day. And as I told you, I practice in bed, so this is a much easier practice than, for example, yoga, which I also love. But I've got to get in my yoga clothes and get to my yoga mat to practice yoga, and even meditation. I have to sit, and I can't do anything else. But with Reiki practice, I can actually do it in bed while I'm waking up and while I'm falling asleep. And even if you want, while you're watching television or talking on the phone, certainly if you're talking on the phone and you're having a difficult conversation, it's great to have one Reiki hand on you while you address the misunderstanding. So, the other thing I want to tell you before I start looking at the questions is that Reiki practice is safe. There, again, is a lot of misunderstanding and misinformation about Reiki, that has been spread very innocently because Reiki practice is basically a home health care practice. And so without any kind of regulation, which I completely agree that there shouldn't be regulation about Reiki, but without that, people have kind of, it's been like the telephone game where you tell somebody something and then they whisper it in somebody else's ear and they whisper it in somebody else's ear. And by the time it gets around the room, it's not even recognizable anymore. So this is a buyer's beware market, and you have to be a savvy consumer and choose your Reiki connection carefully and with your instincts, to make sure that your Reiki practitioner, your Reiki master, is somebody who is kind and that you feel a rapport with and who communicates well with you. So, no matter what you hear or read, please remember what I'm saying, that Reiki practice is safe as long as you are using it sensibly. So, for example, that might mean picking up the phone and dialing 911 with one hand while you have your other hand on someone who just took a bad fall and you don't know if there's a fracture or not. Putting a Reiki hand on yourself or your friend on the way to the hospital or in the recovery room after surgery, at any time that the person welcomes it, your Reiki hands are safe. Just make sure you're doing whatever else needs to be done. And when in doubt, remember that Reiki practice is balancing. If you take one word away from our conversation today, let it be balancing. Because if you remember that what Reiki does is help your own system to balance, then you can understand how it can be safe in a variety of situations. So I am looking, and my eye went right to the question, do you think that Reiki can be incorporated into modern healthcare? And I don't just think this, I absolutely know this because I have been doing this for almost 20 years, and I have set up hospital programs in a number of New York City hospitals and consulted on other hospital programs. And actually, there was a survey done by the Hospital Association and the Samueli Institute that was just recently released, and 21% of the hospitals that returned the survey, that filled out the survey, said that they were offering Reiki right in the hospital. So I'm going to look at these questions. And
we have a question from coming in, and it says, can you share one of your most amazing results achieved using Reiki?
You know, I would really rather not do that because there are amazing healing experiences that happen with lots of different healing practices, and that's not what's so important. What is important is the little stuff that you can do every day, or by seeing your Reiki practitioner once a month, or whatever way you can bring Reiki into your life. And that's why I stress that this is a healing practice. And it's a practice that can be offered in treatment, but it is essentially a practice. And this practice was started in Japan in the mid-1920s by a man named Mikao Usui. And from the very beginning, it was a practice. He wanted his students to practice first on themselves every day, and then on others as they were able to. And that reminds me, when it comes to choosing a Reiki master or a Reiki practitioner, the most important question that you can ask is, do you practice daily Reiki self-treatment? And if that practitioner or Reiki teacher does not practice daily Reiki self-treatment, I would move on to the next practitioner, because why would you want to receive a Reiki treatment from that person? You know, if you want to learn how to golf, you're going to go to somebody who actually golfs, right? And golfs, if not every day, but very often, because golf isn't a healing practice, although some people probably think of it that way. So let's see what else.
Pamela, can you answer this question? Is there an age limit or age restriction for Reiki?
No, very good question. Reiki practice is safe for people at any age and at any level of health or lack of health. I have also trained people who have psychiatric diagnoses, and they have learned to practice on themselves, and their psychiatrists have told me that they felt that it was very beneficial. Generally, you can offer Reiki to even a neonate, and in my book, I talk about Dr. Larry Pilevsky, who was then the chief of pediatric emergency at Lenox Hill Hospital, and he would use Reiki treatment as was feasible when a baby was born with any kind of less than optimal indications, and he found that often that was all that was needed. And also he was able to track these babies to make sure that they didn't revert, and he found that their good health continued, and the babies and mothers left the hospital in the normal amount of time. Reiki is also very useful at the end of life, even when we know that the body is not responding. Reiki treatment can still be very useful because, as I said, it's a spiritual healing practice. And cure is not always available, but healing is always available. And sometimes the best healing that we can offer someone is a peaceful death. And that is also very healing to their families.
Are there any sounds or music that are associated with Reiki? You know, sometimes you go in for a massage and they have soft sounds playing. Is it the same with Reiki?
You know, there's music that Reiki practitioners prefer, but traditionally there aren't any sounds connected to it. When you're practicing or receiving a Reiki treatment, you should do what you like. I always offer my clients a choice. I have some lovely flute music by Steve Gorn, who is a Bansuri flute master, and it's very gentle and uplifting, and I usually have that playing, but I always check the sound level and ask my client if they would prefer silence. And I myself prefer silence when I am receiving a Reiki treatment or practicing on myself.
Wonderful. Thank you.
I think somebody asked a question about Reiki and massage. Y'all, what's the difference? Huge, huge difference. With massage, which is also a wonderful healing modality, and there is so much research that supports the benefit of appropriate human touch in healing. But massage, by definition, involves manipulation of the tissue, whereas Reiki, by definition, is light touch or even non-touch when necessary. Just floating the hand above the body. For example, if there's a burn or an open gash, you don't want to put your hand there. You don't want to actually touch, but you can hold your hand a few inches off the injury and it will still be beneficial.
Wonderful.
Reiki can be practiced anywhere. I see this question and I'm so glad you asked it, because Reiki, although, look, nobody's going to deny that a quiet clinical setting is ideal, but one of the great advantages with Reiki is that it's not necessary. So this means, for example, that while people are in surgical holding, waiting to go in for surgery, they can have a Reiki practitioner there or a friend or family member who's Reiki trained, and we all know that hospitals are pretty busy and noisy places. And I'm often called into the recovery room right after surgery, and again, that's not very quiet in most hospitals, although some hospitals have gotten much better. And I also have practiced Reiki on people during surgery. I have been in the operating room with Mehmet Oz, our beloved Dr. Oz, and other surgeons. So, and operating rooms, there's not usually soft music playing there because the surgeons might fall asleep. We want just the patient to be asleep, and everybody else we need to be wide awake and very alert. So what is the difference between Reiki and holistic health care? Another very good question. When we add Reiki practice to even the most invasive healthcare situation, which would probably be surgery, it becomes a holistic healthcare situation, because everything that the invasive interventions are not able to address is addressed and balanced by the Reiki treatment. And this is perhaps the greatest benefit that Reiki practice can bring to conventional healthcare.
Great.
Do I have a daily routine I recommend for practicing Reiki at home? The routine I recommend is the one that you actually will do. That's most important. So as Mrs. Takata, the Reiki master, who with her Reiki master, Chujiro Hayashi, who was trained by Usui, the Reiki master who started this lineage, as Mrs. Takata often said, a little bit of Reiki is better than no Reiki. Any Reiki is better than no Reiki. So do what works for you. In 21 years of teaching people to practice Reiki, what I found is that for most people it's easiest to practice in bed. But occasionally, for a mother, for example, maybe she just can't wake up a few minutes early to have even a few minutes of Reiki practice in bed. Maybe your kids jump in bed with her, to wake her up. And sometimes moms find it easier to get their kids off to school and then to curl up on the sofa and practice Reiki. Or I remember one psychotherapist who liked to do her self-treatment between her time and her evening patients. So it really is, this is a totally pragmatic question, and find the answer that works for you. But what I do suggest is that you think of practicing, if possible, for at least 20 minutes. Less than that is better than not at all. But in 20 minutes of practice, what you'll find is that your mind will become very relaxed.
Wonderful. So we do have another question, and it says that I usually do Reiki on myself before I fall asleep or wake up in the morning. Regarding one hand, is it okay to give one hand on myself while petting my cat simultaneously?
Your lucky cat. Yes, it's fine to do one-handed Reiki. You know, sometimes the people that I train, because I collaborate a lot with physicians, I'm often working with people who have physical restrictions on their ability to practice. So if somebody has restricted mobility in one arm, for example, they may only be able to practice with their other arm, and we're still seeing considerable benefit. Remember that the Reiki treatment is balancing, which is another way of saying that every Reiki treatment is a whole system treatment. And that whole system balancing response happens whether you have one hand or two hands. You know, there's something about where the hands are. Of course, that's always nice, and we all have our preferred placements, but regardless, just getting a Reiki hand anywhere on someone is enough to create that healing response that then balances the system and optimizes the system's own self-healing mechanisms. So that even after the Reiki treatment is finished, whether it's your self-treatment or you're receiving treatment from someone else, your self-healing mechanisms are still functioning in your own system, and we just don't know how long that enhanced healing process will continue.
That's great. There are a couple other questions that came in, and I'd like to answer them as well.
Pardon?
But there's a couple other questions that came up in the chat box if you're interested in answering them as well.
Yeah, I see one here that I'm very interested in. How does Reiki compare with meditation, yoga, and other techniques? For one thing, I wouldn't use the word techniques here. I really like the word practice because it reminds us that we have to do it. And it's the practicing that makes the difference more than anything else. You know, we can be trained in a number of different practices, but if all we have is the training and we're not actually practicing it, we're not getting the benefit. So all spiritual healing practices, such as Reiki, yoga, meditation, Tai Chi, Qigong, prayer, just to name a few off the top of my head, they all have the same goal, and that is to bring the system to a state of balance and maintain it there so that the person can access that inviolable core of wellness that is our essence and our birthright. That doesn't happen immediately. It doesn't happen overnight, but it does happen gradually with repeated practice. There is a quote from a 20th century Christian mystic, Teilhard de Chardin. He said, "We're not human beings having a spiritual experience. We are spiritual beings having a human experience." When we suffer, when we have anxiety, for example, it's because we experience ourselves as human beings first. And then maybe we get a break and we get a glimpse of something greater than that, something more spacious than being a human being. But as we have a spiritual practice and as we practice regularly and, dare I say, relentlessly, no matter what, and this is where Reiki has a great advantage because we can practice in bed, but slowly over time, our sense of who we really are begins to shift so that we think of ourselves first in the spiritual context. And that means we don't just think of ourselves, but we think of everyone else and the world around us and how we are connected and how we can be of benefit to everybody at once, not in either or situation. So this is where daily spiritual practice is really enlightened self-interest. We have to take care of ourselves first, or we're not going to have anything to give to others. Just like on the airplane, where the attendant reminds us every time, if the oxygen mask drops, where do we put it? On our faces first. Even if we have our child or our grandmother next to us, on our face first, because we need to breathe in order to be able to function well enough to take care of the people that depend on us. And so our daily spiritual practice is a very real way to breathe and to discover some of the great mysteries of life that make life very sweet, no matter what the details are.
That's wonderful. Pamela, would you mind just telling everyone where they can go to access your information, your website, and the name of your book?
Thank you. I will do that. And I just see one question here that I would like to address, and I promise to be fast.
No, absolutely. Take your time.
I had surgery in August, this person says, a gallbladder removed. And I gave myself a Reiki treatment before surgery, after surgery, yay, prior to tests, etc. The question is there a benefit to self-treatment if your body is so obviously out of balance? Yes, absolutely, because the treatment is balancing. And this brings up some of the very common misunderstanding about Reiki treatment when people talk about energy and stuff like that. It's so misleading. The treatment itself is balancing. It precipitates through a mechanism that we don't understand, okay? Science does not yet know how Reiki works. But we do have scientific documentation of the physiologic benefits that heart rate is improved and respiration rate is improved, things like that, indications of deeper relaxation. And it's in the state of relaxation when the parasympathetic nervous system is dominant that the body's own self-healing mechanisms kick in and function optimally. So my name again is Pamela Miles, Miles, and I have a website called Reiki medicine.org, or you could just Google Pamela Miles Reiki, Reiki, and it will take you right to my website. If you are already a Reiki practitioner, you might be interested to stop by my Reiki Med Facebook page. It's facebook.com/Reiki Med and join the conversations there. And also to go to my website and click the blog on the navigation bar and read that and offer your comments. Roxanne and Stephanie, I want to thank you so much for allowing me to share practice with everybody.
Thank you so much. It was a great pleasure having you here today.
Bye, everybody.
Bye-bye.